Hello, my name is Ashlyn Baker, and today I'm going to be demonstrating how to obtain a sterile specimen from a Foley catheter. So before I began, I did come in here 15 to 30 minutes ago and I did clamp the catheter. That way the specimen I obtain is sterile, because once it touches the bag, it is no longer sterile. I have gathered my supplies. I do have alcohol swabs, sterile gloves, a 10 milliliter syringe, and my label, and then of course the specimen container. So now I would perform hand hygiene and place my gloves, my non-sterile gloves, and of course that is after I've assessed my patient's level of consciousness to person, place, time, and purpose. And I did check her bracelet. She's not in any pain and does not have any complaints at this time. So I am going to go ahead, like I said, for demonstration purposes, I will not be applying the procedure gloves because they are in my kit as my sterile gloves. So right now I would have non-sterile gloves on. So I am pulling my patient's sheet back and just taking a quick look at the catheter, no redness or irritation. So here I would go ahead and remove my gloves, perform hand hygiene, and I will be opening my sterile field. Can you see this? Okay, so now I would be applying my sterile gloves. So I will pull these off to the side. And can you see over here? Let me slide this way so you can watch me apply them over here. Hold my package. Hold my package. And then under the lips. And then here I would grab the cuff because the outside is sterile, of course, orienting myself, and I will be sliding my hand in this way. Okay, and then on this side I'm going to reach under. So under the cuff, orienting myself, and applying it. And now is when you can situate your fingers and such. So now I will be opening my alcohol swab and cleaning where I will be placing my syringe. Okay. Discarding, of course, I would never turn my back on my sterile field. Inserting the 10 milliliter syringe. And I'm gonna pull my 10 milliliters out. Okay, I have my 10 milliliters out. Now I'm going to grab my specimen container and place it in my specimen container. Then I would discard of this syringe, place my cap, my specimen container, and I would label it with what type of specimen it was, who obtained it, and who it came from. And then the date and time, of course. And I will place that in a laboratory bag, and I will take it to lab. And again, just cleaning the specimen port and unclamp so that the urine flows back to the bag. We don't want it flowing back up there. Then of course we could have UTIs and other complications. So I will clamp it back to the bed. Cover my patient, assess for any discomfort, if there's anything I can get her, discard of all my supplies, and like I said, take this to the lab and then come back to check on her in a little bit. Thank you. and hand hygiene.